Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN, Healthy World, Healthy Nation, Healthy You. I'm Nancy Valentine, PhD and registered nurse, and this show is dedicated to you, the healthcare consumer. And today we have the pleasure of meeting a neuroscientist, someone that I don't think most of you are going to meet on your day-to-day walk through life. But this is why the show is so exciting, because you get a chance to meet someone who's very educated and will educate you to some very relevant information that is going to help your health and wellness. The title of our show today is It's All About Timing: Biological Rhythms, Sleep, and Applications to Your Human Health. And the person that's going to be educating us today, I will introduce in a minute, Dr. Donald McEachran. And he is a neuroscientist, and we are going to be talking about how all these things having to do with timing are really very relevant to your health, wellness, and perhaps even to some treatments that you're getting. So this show will discuss the role played by biological rhythms in both well-being and medical treatment. And we'll discuss some methods by which individuals can promote internal health and also how to promote sleep hygiene, which is very pivotal to much of this. So the 3 key points that we're going to be talking about with you today are: we are evolving much faster culturally than we are from a biological background. So we really are mismatched, as Don will tell us, with the world that we're living in and how our biology has evolved, and how some of this mismatching has to be taken into account in terms of how we deal with our own health and how we talk with our healthcare providers about some of the treatment options. The second is that our body needs to be kept in tune, just like our cars. And so these rhythms have to be balanced, and he's going to give us lots of tips on how we can balance our rhythms. And then third, don't we know this already? Mother knows best. And sleep hygiene, being able to sleep at a regular time and have the same number of hours of sleep, by and large, is very, very pivotal to your health. So this opportunity to really learn about this from a much different point of view, I think you will find very interesting, as you will find our guest, Dr. Donald McEachran. Dr. Donald McEachran is the teaching professor in the School of Biomedical Engineering and Science and Health Systems at Drexel University. And he has a PhD in neurobiology, and he is a neuroscientist, as I said earlier. He has a very long bio background. He's a great guy. He is very personable. He can bring this down to earth, which is very, very hard to do, because he lives in a world of abstract ideas in some cases, but he's going to tell us about his field that's been around for a long time, hasn't necessarily gotten the traction that it really needs to get. So that's the purpose of this show. Our show with Don today is to really help you understand this very complicated area, but not complicated when you really get it boiled down to really facts of the case and how you can use these tips every day. So Don, I want to welcome you to our program today, and I think that one of the best places for us to start is your field is chronobiology.
Chronobiology is the study of biological rhythms. And if you think about it, as you breathe in and out, you breathe back and forth, that's a rhythm. Right? It's very important to maintain that rhythm. We know about heartbeat, one beat after another after another. This is, again, a rhythm that allows you to pump blood throughout your body. As it turns out, in the research that we've done in the last few years, the entire body is built on a whole set of these cycles and rhythms. And one of the more interesting rhythms, and perhaps one that organizes the entire symphony of rhythms within the body, is a type of rhythm called a circadian rhythm. It's a funny name. It's Latin for about a day. And circadian rhythms run at a frequency of about 1 cycle every 24 hours. And most of us are kind of familiar with this, right? We go to sleep at a certain time of day, we wake up at a certain time of day, we go to work, we watch our favorite television program, whatever we're doing, it's on a timed cycle. But as it turns out, even if there were no clocks, you were not exposed to the day-night cycle, if you were totally isolated in a bunker or in a cave, you would still have a near 24-hour rhythm in every physiological variable and psychological variable in your body. It's run by an internal clock built into your brain that keeps track of this 24-hour rhythm. And this rhythm helps to organize all the rhythms of the rest of your body, including things like heart rate. Let me give you a quick example. As it turns out, when you go to sleep, when you lie down, your heart rate tends to decrease. It tends to drop. This is normal. It would happen with most people. But there's a group of people we call non-dippers.
Non-dippers?
Non-dippers.
Okay, that's interesting. What's that mean?
It means that their heart rate does not decrease as much as other people's when they lie down and go to sleep. There's a problem with their circadian rhythm that controls heart rate. And as it turns out, non-dippers are at high risk from myocardial infarction, which is the technical term for heart attack.
Now, how would you even know if you're a dipper or a non-dipper? That's
Typically,
a whole brand
you
new
would
term.
not. But nowadays, cardiovascular scientists, the doctors that take a look at our hearts, will put on a Holter monitor, and they'll be able to look at you across 24 hours. It's not enough these days to just look at an EEG within the doctor's office or within the hospital. It's necessary to look at a 24-hour rhythm so that you can see whether the individual has that particular issue or not.
That is very interesting. Explain to us about a Holter monitor. Some people may know what that is, and some people may not have been acquainted with that, but it is a fairly common test for people. So tell us how that works.
Well, I'm supposed to be actually undergoing this test myself soon.
Well, personal experience.
So we are going to be attaching a EKG device, something that will measure my heart rate, something that I can wear across 24 hours. And you go into the physician's office, they outfit you with one of these. You're able to take this and wear it for 24 hours. And this will keep track of the way your heart is functioning over that period of time. Now, in my case, I have a situation where my heart has an irregular beat.
Okay.
And they want to see if that irregularity is tied to sleep,
Okay.
and see whether or not it becomes a real issue or whether it's just a slight variation on my normal pattern. But they need this 24-hour.
But this is a good
record.
example from what you're telling us of why rhythms are so important. And now everybody has their circadian rhythms, which you've just educated us to, and that really propels our sleep pattern. But in terms of diagnosis, this could be one of the diagnostic indicators by wearing this Holter monitor that would give the doctor and give the patient some idea of what the derivation of this problem is, meaning like what is causing it before they even move into a treatment plan.
Yes, you certainly need to recognize that the issue exists. And although Holter monitors can do this sort of thing, one of the things that one should be aware of is this not typically done.
Okay.
It's unusual to give a Holter monitor unless you have some indication that it's necessary. The reason that my heart physician, was going to give me a Holter monitor was that I had described this sort of sense that my heart was leaping into my throat. And so I had taken my own heart rate. I'd noticed there was this sort of skipping of a beat. And so I informed him that this was the case, and then he prescribed the Holter monitor. If you do not know you're a non-dipper, if you do not know that your circadian cycle of heart rate is different, there's no reason for a physician to prescribe the Holter monitor. They won't know that they should do this. And one of the reasons that I would like to talk to the public and to you about this is that there are a number of situations where abnormal circadian rhythms or disruption of circadian rhythms can lead to disorders and disease or make disorders or treatments ineffective.
Right.
And people need to know this, and it's not common knowledge in the medical field among practitioners at this moment.
Right. Well, let's talk about that for a moment. In terms of these sleep rhythms, Don, is it important that people really monitor their own sleep? Because this really sounds to me like this is where our biology sort of clashes with our culture, because we're in a fast-paced culture. Lots of people aren't sleeping regularly. They have a lot of sleep disruption. Do you think that that is in some way contributing to illness?
Yes. The recent research that I'm aware of has shown that sleep is necessary for a number of activities. For example, your immune system tends to come online during sleep. It tends to increase its ability to respond to infection. So if you don't sleep, your immune system is less effective against disease. Memory tends to become consolidated, which is a fancy way of saying that your memories become more fixed within your brain. Your memory is enhanced by sleep. If you interfere with sleep, you interfere with your ability to remember. And there's been a really interesting set of experiments just recently, which is really kind of cool, where they were looking at a type of sleep called rapid eye movement. You may hear of it called REM sleep. It's when you go to sleep and your eyes move underneath your lids. It's associated with dreaming, not the only time you dream, but it's associated with it. And it appears that if you do not have enough REM sleep, it interferes with your emotional memories, but in a really interesting way. It interferes with your positive emotional memories, but not so much with your negative emotional memories. So as you become sleep deprived, the balance between positive and negative emotion and memory shifts in the direction of negative.
Interesting. So that would certainly affect people's moods when they wake up.
That's right.
Is that the euphemism of you probably woke up on the wrong side of the bed kind of thing? Meaning that maybe the real science is that you didn't have enough REM sleep?
It could be. It could be. It certainly is true that when you do not get adequate amounts of sleep, problems seem much worse than they would normally.
Well, it seems like one of the takeaways from this discussion thus far is that your sleep patterns are a very important part of your overall health. So obviously it's something that you need to pay attention to. But I think in terms of what Don is saying, even from his own experience, maybe your sleep patterns are something that you should be sharing with your treatment team. So when you go for your primary care visit, that's not necessarily a routine question, what are your sleep patterns? Some people will ask, but I don't think it's really on that necessary checklist of things. But that's something that you should volunteer, because that is really information for your doctor, nurse practitioner, your team overall. Really understanding what your rhythms are is really very important, just like your temperature is taken, or your pulse rate is measured, or they listen to your heart rate. Maybe your sleep patterns are really just as important. Would you agree?
I would agree. The two things that you might want to indicate to your physician. One is, how much are you sleeping? Do you feel like you're getting an adequate amount of sleep? Do you feel sleepy during the day? These days in our society, we seem to get used to this idea that we feel a little sleepy during the day. But that's not the usual pattern for most animals and humans when they get enough rest. They don't really feel sleepy during the day. So one thing to indicate to your physician is, how much sleep are you getting? Are you getting enough? Do you feel rested? The other thing would be, are you on a regular schedule? One way I've always taught people to tell whether they're getting enough sleep and if they're on the right schedule is they wake up before their alarm goes off.
Okay.
If you are waking up before your alarm goes off and you feel rested during the day, you probably have both adequate amounts of sleep and a good schedule.
Right. But how about those people that are nappers? I mean, there are people that are somewhat chronic nappers, and they feel it's really great. They feel like they shut down their brain for maybe 20 minutes or a half an hour during the day, and they feel like they're very refreshed.
The research on napping isn't as consistent as it is on sleep per se or circadian rhythms. Some people seem to do well doing those kinds of naps. Other people do not do well.
Right.
One thing I've noticed with myself is that if I sleep in a nap, and I nap occasionally, I'm getting up in years. I think I'm napping more often. If you nap across the light to dark transition, so you go to you sleep for your nap when it's daylight, and you try and wake up when it's dark, that is an exceedingly difficult thing to do. And that's hard on your system. 20-minute naps, I think, are probably not such a bad idea if you feel tired. I certainly, there was this incident, I guess last year, was it? Where air traffic controllers were having difficulty at Reagan National Airport. And this would be a difficulty if you're up at night and you're looking at a bank of instruments. It's very hard to stay awake. Humans are not nocturnal. They do not do well trying to stay up at night. And I remember the head of the FAA coming on to a news program and making what I considered to be an appalling statement. Somebody had suggested they put an extra air traffic controller in the tower and let them nap off sync from each other to make sure they were awake. And I thought, what a great idea. And the FAA had said, we don't pay people to nap. That is an archaic position. That indicates an individual who is unfamiliar with the physiology of human beings.
Right. So that would be a very interesting application of this chronobiology scope of knowledge. But there are a lot of shift workers. How do shift workers cope with this? I mean, let's use nurses as an example that I'm familiar with. There are thousands and thousands of nurses working the night shift. Some do it for many, many years, and some do it until they can get on the day shift, which could be 5, 10, 15 years into their career, depending on the place that they're working. So how would shift work with these folks? Because they really can't nap on the job either.
That's a difficult question. How to handle shift work properly has been studied for some time. And there really is, as far as I know, no consensus on how to do this. Shift work carries a cost. It tends to lead to sleep disruption, smaller amounts of sleep. The combination of rhythm disruption and sleep disruption has been associated with a series of issues, cardiovascular complaints, gastrointestinal disorders, some types of cognitive disorders, psychiatric complaints. It's a very tough behavior to engage in. Now, one way to think about how one could do this is to have brighter lights where the nurses could somehow sort of rejuvenate themselves. For example, perhaps have a room with bright blue lights, which would tend to suppress a hormone that helps promote sleep, something called melatonin. So if you suppress melatonin, you're less likely to be tired. But as far as I know, there's no consensus on how to deal with this. It is a very touchy issue in our society, which is trying to run it 24/7 with a body which is not designed to run it 24/7.
Well, that's a whole issue in itself. Maybe we could have some subsequent shows on that to really look at the impact of night shift work for anyone that's working the night shift and what they can do to really enhance their health despite the night shift. I mean, my experience is that some of the nurses that I've met are quite adapted to it. I mean, at least it appears in the workplace that they've adapted very well. Your suggestion, for instance, of having brighter light is, of course, very different than what happens on the night shift in most hospitals where the lights go down. I mean, lights are literally turned off or dimmed in the hallway because we want the patients to sleep.
You want the patients to sleep.
Right. So there's a very good example of the push-pull between the circadian rhythm application for what we want to do for our patients versus what we want to do for our staff, to really promote their health, wellness, and well-being overall in the workplace. So let's hold on that, because I think that's a juicy one we can get into in another program. But let's go back to what you were saying earlier about what would enhance people's sleep who are sleeping on regular shifts and trying to really have regular rhythms. In another show, we talked about how a red light is something that's very good that will help you versus other types of night lights that people typically use. Can you give us the details of that?
There's a biology behind that that's really quite fascinating. the light that you use to see objects, I can see you sitting here, you can see me.
Right.
That kind of light is processed by the retina in the eye by a particular system. And for many years, we thought that the information about sunrise and sunset and daytime was processed by exactly the same system. Why would you have two different systems processing light information? But as it turns out, evolution surprised us on this one. And there appears to be a somewhat separate system that conveys light information to your biological clock. In other words, what you can see is processed by one system. What time it is processed by another.
Are these in your brain? Where are they?
The initial receptors are in the eye, in the retina of the eye.
Which is the back of the eye.
Back of the eye. And for people familiar with this, there are things called rods and cones that absorb light to allow you to see objects, motion, color, all the things we think of as sight. But there are cells in the retina called retinal ganglion cells,
That's
which
a
are
big.
neurons.
That's a big one.
That's a big word. But these cells absorb light in sort of the blue-green spectrum, or bluish light. And those retinal ganglion cells are directly wired up to the biological clock in your brain. And so what's really neat about this is that what we call absorption spectrum, the light that is used for object recognition, is slightly off from the light that's used for timing information. So if I were to put in a night light that was red, that would trigger basically rods within your eye so you could still see.
Right.
But it would not trigger very powerfully the system that controls timing. So if you say we're exposed to bright light late at night, that would tend to wake you up. It disrupts your rhythms, it suppresses that hormone I talked about called melatonin. It tends to wake you up. So a bright light late at night wakes you up. If you don't want to be woken up, but you are actually moving, but you still have to move within your room or something,
Right.
Or if you have a child where you want a night light so that the child feels somewhat safe. If you use a red light, it will not suppress the melatonin as much. It will not disrupt circadian rhythms as much, but you'll still be able to see, which is really cool.
That is very cool. From again, isn't it great to know the science in back of something as simple as a red light bulb versus a regular light bulb? But the fascinating part about this that people, I think, will be wondering is, can I really see as well if I put a red light bulb, in my night light or in my lamp next to my bed? What is going to be sort of the trade-off? Are there any trade-offs?
Well, certainly if you're using red light, everything's going to look red.
Okay.
And it is not as easy to see objects in red light when you can't see the color contrast. But I used to, in another life, work as a photographer.
Okay.
And this was back, just to show you how old I really am, back when people used film. And we used to develop these in things called dark rooms.
Okay.
Well, the film was not red sensitive. So we would use very, very dim red lights in these dark rooms. And you could see around. You could certainly maneuver around objects. It wasn't a comfortable light. It's not that kind of light that you would like to see if you're actually trying to work on a paper or manipulate an object, but it's enough to be able to see.
Right, enough to get around.
It's enough to get around, and that's the trade-off.
Right.
There's always a trade-off. And if you'd like to keep your rhythms in tune, you'd like to keep your sleep undisrupted or minimally disrupted, but you still have to get up. A red light will give you that advantage.
I think that's really an important tip because you can experiment at home on your own. I think that one of the things you might want to do is, especially if you're dealing with someone who's older that you know is going to be getting up in the middle of the night as part of their routine, is to try the red light as an alternative. See how they feel about it. See if they can adjust to it. Because it's most important that people really get up, they don't fall, they use the bathroom, whatever they're getting up for, that they're doing it safely. So that is really something that you can use as a tip at home. I think the second is people do probably need some time to get used to it. So it may not be the first night, it may take a couple nights to really get used to it, but once used to it, people will calm down. I think in another one of our shows, we had a guest talk about how she used this with her mother, who was aging and very disruptive at night, very alert, very angry, and couldn't go to sleep, and just really out of sorts. As soon as they put the red light bulb in, she calmed down. She slept every night after that. It was almost magical in that particular circumstance. Whether it's magical for you or not, it's really a good tip that you can use, and it's something practical that you can take away from this discussion. I think that in terms of other things in chronobiology, it sounds like it's a whole field, Don, that we could learn a lot about. There's so many applications to this work.
Well, the key element to keep in mind is that humans are not like computers. If you turn on a computer at 2 o'clock in the morning, you expect it to operate exactly the same way as if you turned it on at 2 o'clock in the afternoon. But living organisms, including humans, are not like that. They are different at 2 o'clock in the morning and 2 o'clock in the afternoon. How they process drugs is different. How they respond to toxins is different. How they react to light and dark, how they interpret emotional events, it's all different. It changes at different times of day. And so it's possible to take this into account and tailor treatments so that you minimize side effects and maximize the effect of, say, a drug treatment by using the proper time of day. And of course, it's also possible to do the opposite. It's possible to make things worse by not taking time of day into account. I wanted to mention something that you had mentioned. I hate to interrupt, but it is true that there seem to be people who are much more likely to adapt to night shift and rotating shift than others. We're not identical here. In this case, there are going to be people who do much better at night shift than others. We just haven't quite figured on a way to screen for that yet.
Right. Well, it sounds like we've got a whole lot of work cut out for us, because you've heard the term personalized medicine, and this is really another aspect of personalizing care for yourself, and we're going to be talking about that in subsequent shows. Today was just a chance to really whet your appetite, and for you to now have a new term that you can throw out at discussions in the supermarket or at a cocktail party: chronobiology. You now know what that is. I certainly didn't know what it was until I met Don McEachran, and I really have enjoyed meeting him. As you can see, he's very interested in his topic. He's very interested in his life's work, and he feels very passionate, as I do, about sharing this with you, the consumer, because you can actually take some very specific actions and have some very new conversations once you have more information about this. So today, I think that we did cover our 3 key points, which was to really talk about our own biology and how we do clash with some of the cultural things that we are dealing with. We use the example of night shift. There are many others. That we really need to keep our own body in tune. Just like we said, like our cars, we have to be really mindful of our own rhythms, and we are learning about that. And I think that we really did focus a lot in this conversation on the value of sleep. So I really hope that you learned something from meeting Dr. Donald McEachran. I certainly have. And I think that we will have other discussions on this topic. But I think that today you can say, I'm going to really try to work harder on my sleep. I'm going to look at the times that I sleep, the duration of my sleep. And I'm also going to think about getting a red light bulb somewhere in my house so that I can test it out, see if it works for me and other family members. So I think that you can have those points to take away from this show. Thank you so much for joining us. And remember, with health, all things are possible. Have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.